Good morning and good afternoon, everyone. I'm Rosemary McCarney, and I'm here today to welcome all of you to Massey College. I'm the Diplomat in Residence this year at Massey College, and I'm also co-chair of the Climate Action Committee at Massey College. So welcome, everyone. It's lovely that you've been able to join us. As many of you know, Massey College is built on the land where many Indigenous people have lived and continue to live. It's the land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. And I want to acknowledge our duty of stewardship towards the land and the great privilege and honor that we have to work on this land. So welcome back, everyone, and welcome to Massey is Missing COP26, our initiative. And we're very pleased to have you join us as we kick off this new series of explorations on how the critical areas to be addressed in the November meeting, the long-awaited meeting of the Conference of State Parties, or more familiarly known as COP26, being hosted by the Government of the United Kingdom this year in Glasgow. We thought it's an important moment in climate action, with this meeting representing an accountability moment for the world's leaders on the commitments that they made in 2015 during the Paris Agreement, when they last really met as heads of state. And so in the interim, as we all are acutely aware, a pandemic has spread across the globe, and that has touched every part of the world as we all struggle to manage through it. Massey felt that with the postponement of COP26 last year in 2020, because of the pandemic, it actually provided us a moment to reflect and to examine all of the climate change interdependencies. And so through these Massey is Missing COP26 webinars, we've been able to talk to some of the iconic activists like Lloyd Axworthy and David Suzuki. We've talked and examined finance and climate change. We've looked at climate change in the arts with the Royal Ontario Museum, climate change and investment financing, and climate change and cultural impact. And these are all still available on the Massey website on YouTube. And today promises to be an important and I expect a very revealing conversation on climate change and human health. And how can it not be? Because Massey College has assembled three passionate experts in the interplay of health and medicine and climate change. So joining us today is Dr. Courtney Howard, an emergency physician in Yellowknife in Canada's subarctic, and a clinical associate professor in the School of Medicine at the University of Calgary. She's experienced both in Africa and in Canada and many parts of the world the devastating impacts of climate change on human health and how it presents differently in different geographies. She's now a globally recognized expert helping bring these important conversations on this tragedy and the accelerating crisis to audiences across the planet. And Dr. Howard lives and joins us today from the traditional homeland of the Yellowknives, Dene, and the traditional lands of the North Slave Métis. Joining with Dr. Courtney today are two Massey College Junior Fellows. Jean-Paul Soucy is a Vanier Scholar and a PhD candidate in infectious disease epidemiology in the Dalai Lama School of Public Health and at the University of Toronto, and focuses his research on infectious disease surveillance. He's the co-founder of the COVID-19 Canada Open Data Working Group and a founding editor of the University of Toronto Journal on Public Health. Also joining us, another junior fellow, Dr. Andrew Terence Lamb. He's a first-year resident physician in public health and preventative medicine. He holds a Master's of Public Health and a Doctor of Medicine from the University of Toronto. And the newly minted Dr. Lamb was also the national representative to the Canadian Federation of Medical Students and the College of Family Physicians of Canada. So welcome all three of you, and thank you so much for your time and your passion on this issue. And we're just going to launch right in, because all three of our panelists today are healthcare sector specialists. And I'd like to explore in general through our time together how it is that medics and nurses, doctors, midwives can use their hard-won credibility through their high-profile roles through the COVID-19 in advancing understanding of the relationship between human health and climate change. In my view, this area has had the least amount of public discussion and understanding of the very both direct and secondary links, except for very small specific slices. And their role and voices are not yet, in my view, seen as essential in policy formation in the climate change and human health area. But COVID has raised their profile out from behind the white gown, and in Andrew's case today, the scrubs, and the trust in the public is at an all-time high in their views. And now, my question to the panelists, and I'll start with you, Dr. Howard. What can they do to use that newfound profile and wide trust to advance the commitment to climate change? And you've written and spoken broadly on these issues. What do you think are the big and looming issues where in your assessment, these are our new activists as well?
Thanks for that introduction. And you've definitely really drawn out some of the opportunities of this moment of crisis. I've been working on climate change and health for about 12 years now. I first learned it was a health issue up in Inuvik when I was serving a majority Indigenous population in a place that turned out to be 3 degrees Celsius warmer than it was when an 80-year-old elder was born. And I went to PubMed, which is where we go look up journal articles. And it was right after The Lancet had come out with its first commission on climate change and health, which said that climate change is the biggest health threat of the 21st century. And I had just graduated from McGill. And I was like, they did not mention that. How did I manage to get all the way through emergency training without anybody telling me about the biggest health emergency? And so we're at this really interesting moment where it is the biggest health emergency. Impacts are being felt, wildfires, the heat dome, etc. And yet it's still actually not in medical curricula, according to the curriculum surveys that the Canadian Federation of Medical Students Association has done. And so in many cases, not only do policymakers and the public not know what they don't know about climate change and health, but actually a lot of the medical profession doesn't either. So we have that. But meanwhile, there's actually quite a big body of work now that's been brought out by people like the Canadian Association of Physicians for the Environment, the Global Climate and Health Alliance, Planetary Health Alliance, and others that has been working really specifically at that junction. And how I now understand health is that the ecological determinants of health, things like soil, water, the climate, in fact, form the necessary underpinning for everything that I do in the hospital. I think of it like a nest. So if that's stable, we get to build the social, financial systems that give rise to the social and structural determinants of health, things like income, education, et cetera. And if that's really going well, we get to build the extremely complex system that is a high-income country's healthcare system. And so when I go to work in the emergency department, I'm very proud of the work I do there, but I'm now conscious that what we do in healthcare systems really only accounts for about, depending on which study you look at, 5 to 25% of overall health outcome. And given that we're dependent on everything under us in that nest to support our work in terms of staffing and different types of logistical supply chains, really, the ecological determinants of health are absolutely necessary. And so we're starting to communicate that to doctors and healthcare system representatives. I'm on the board of the Canadian Medical Association, and actually attending to climate change and health is now one of the top 3 strategic priorities in our new strategic plan, in recognition of the fact that, if wildfire is blocking your highway, you're not going to be able to supply your hospital. And also our responsibility to decrease our emissions within the healthcare system. And more broadly within society, as you mentioned, we know that healthcare practitioners are amongst the most trusted messengers. And there have been several communication studies that have actually looked at different frames for talking about climate change. And it turns out that the actual best, stickiest frame across nations for motivating people to take action on mitigation is actually to talk about the health co-benefits of different things that also decrease greenhouse gas emissions. So there was a big study that came out from Harvard this year that showed that about 1 in 5 global premature deaths is as a result of fossil fuel related air pollution. So that's huge. So that means that anytime we do anything to decrease fossil fuel related air pollution, we save lives. Solar panels that replace coal fired power or gas fired power save lives. Electric vehicles save lives. And so when we talk about it like that, and if we start to quantify those impacts in terms of saved money to our healthcare system, in terms of health and social cost savings, really we can start to change the equations that we use to determine the risks and benefits of different elements of transition. And I think that at this moment when, as you've mentioned, health has been shown to be more fundamental to really our lives and our experience of our time on this earth than really almost any other element. It's a time for us to start building that new awareness into our equations and use it as a driver for change.
Just a follow-up question too, and it's you touched on it. I think what you've said is how do we make it personal? And so
Mm-hmm.
climate change and the impacts are often presented in massive aggregated numbers, and it's hard to bring it home. And if I understand you correctly, you're suggesting if you make it you can make it personal because it is about your health, not only the health of the planet, but your health and that of your family.
Absolutely. I've been lucky to work in emergency departments across Canada. So, Vancouver, Victoria, Ottawa, Montreal, Nunavut, lots of little communities here. And so that means that I've taken care of Canadians who are well known politicians. I've taken care of people who are well known in the arts. And I have taken care of significant people who are underhoused and Indigenous communities and moms from down the street. And every single person at 2 o'clock in the morning in a hospital gown, the only thing they really care about is their health. So I believe that the drive for health and well-being is probably the value we all share the most fundamentally, and that we really want that for ourselves and for others. And so when we look at how we've been communicating about climate change for a long time, it was about polar bears. And luckily, the communication scientists came and started doing some research, and they were like, the humans sort of care about the polar bears and not really that much. And so it turns out that talking about it in terms of the health impact is one of the most persuasive ways to help people understand what climate change means for them. Because if we're asking people to change what they do next Tuesday on behalf of the polar bears, the balance of motivation there is very different than if we're saying, hey, how about you change what you do next Tuesday so your kids can have something to eat in the year 2040, and so your hospital can be well supplied the next time there's a big wildfire and you need help. And so those personal stories are certainly really important. And we actually know from other literature bases that it's really those moments, the wildfire that means that your vacation is disrupted and you have to move, the heat dome that leaves your elderly parents really in difficult circumstances in an underventilated apartment in Vancouver, the Lyme disease that sort of imposes itself on your time at the cabin when your child goes out and ends up with a tick bite and all of a sudden you're worried. These are moments of stimulus that lead people to say, oh, the world is different than I thought. Now I need to do something. And so it's up to us now to really connect that stimulus to the action items that are going to get us to the place where we will be safer.
Thanks very much. And actually, what you've raised is just a great segue for me to look to Jean-Paul for a moment. Jean-Paul, you've spoken and have done a lot of thinking about some of the additional issues that Courtney just kind of hinted at that have your attention and time and that are being felt very close to home, although not equally distributed across the country. So, maybe perhaps you could comment on that in terms of, how do we bring this connectivity, this codependency of climate change and your health home to Canadians?
Sure. As someone who's primarily interested in emerging diseases and antibiotic resistance, I'm just struck by how much these topics that I'm interested in connect and intersect with the questions of climate and the environment. So obviously, it was not too long ago, maybe mid 20th century, that we in the West thought we had eliminated infectious diseases as a social force in our lives. Clearly, that's not true, as the last year and a half has shown us. But the question is, where do these novel diseases come from? And ultimately, what it boils down to is between human beings, livestock, and wildlife in the same environment. And so, for example, as meat consumption explodes in the world, kind of catching up to how much meat we eat here in the West, we see more and more environments being, for example, cleared for livestock farming and ranching. And what that does is it pushes more uh, wildlife onto that boundary between human beings and livestock and wildlife interact. And from there, you can see diseases jumping from wildlife to human beings, either through livestock as an intermediary or directly to human beings. And that's how we end up with novel diseases, which are now capable of more easily than ever. And this also relates to other novel disease outbreaks we've seen. A specific example would be Nipah virus in Malaysia. What happens here is we see that the forests that these bats live in are cleared for orchard bats. The fruit bats start to hang out in those orchards instead, and that's how we ended up with the Nipah virus outbreak in Malaysia. You mentioned Lyme disease. I think that's also a really good point. It was only a few decades ago, virtually no one would even know what Lyme disease was. But as the temperatures kind of get warmer and the ticks move north and actually contract at their southern boundary because it's too hot for them there, and then we're seeing that our enjoyment of the outdoors in a lot of parts of Canada is just that much more complicated because we have to worry about ticks and tick bites and the real difficult disease that Lyme disease is to diagnose and treat. Agriculture as well. Another thing that I think is important to note is that most antibiotics that we use in the world are not used for human beings. They're used in agriculture, and this is something, thankfully, we've been moving away from. But still, this means that we can end up with situations where we have antibiotic resistance developing within livestock, and we see those antibiotic resistant infections happening in livestock and, of course, transferring back to human beings. And the more that we use antibiotics in that setting, the more that we're going to see that those are not going to be effective when we need them to treat human beings. And so I think these are really all very interconnected topics.
Absolutely, and thank you for bringing some of those closer to home, because I think one of the things that we're touching on is the fundamental importance of making this real to everyone, that it's very much in their backyards. It's not a far away problem or someone else's problem. It's very much affecting your health, and the increased health risks of things like Lyme. And I'm sitting here today in a very Lyme endemic region of the country, and there isn't anyone in this population that isn't highly conscious of Lyme and the things you need to do. Whereas before, I used to just walk out the door in your bare feet and go for a hike in the woods. That nobody does that anymore around this area. Let me move to Andrew, because Courtney touched on this in her opening remarks. I'm really interested, Andrew, as a newly minted doctor, and congratulations on that, really interested in how medical education institutions are equipping young doctors and nurses for this multidisciplinary world of human health and climate change. And you might want to comment on this, Andrew, in terms of your training as a young, recently minted doctor, and what you think about kind of how you've been equipped. As Courtney said, she may not have been, and is trying to affect those changes. Perhaps you could comment on that from your early perspectives.
Thanks very much, Rosemary, for for this question, because as I was sitting here reflecting on Courtney, Dr. Howard's remarks there, it really made me think back to my involvement with the Canadian Federation of Medical Students, but also some of the work they're doing in one of their planetary health groups as well, which Dr. Howard is a strong advocate and member of too. And as she pointed out in a recent survey, just under half of our 17 medical schools in Canada incorporate education in terms of planetary health and climate change in their curriculum. And even then, not all of those, so there's 17 medical schools, 8 of them incorporated into the curriculum. And among those 8, not all of them assess on those competencies. And so to say there is some variability across our nation in terms of how our future generations of physicians, healthcare leaders in nursing and midwifery are equipped, I think there is quite a bit of disparity across the nation. Without isolating any particular regions, I think it goes to say that graduates coming from different parts of Canada may have varying levels of exposure and comfort in addressing many of these issues we see. But regardless of where we are, regardless of where we train for our residency and where we practice in the future, I think we see the same pervasive issues. On a day-to-day basis in the clinical environment, we run into scenarios, whether in the emergency department, in the operating room, or even in the outpatient clinic setting, where we're challenged with these ideas of what can we be doing better for an environment? What decisions do we need to be making with our patients to advocate for the wellness of our planet in the future? And more specifically, a few examples. In the emergency department, I'm based here in Toronto, as you mentioned earlier, and a lot of these supplies we have, and I imagine it's similar across the nation, are single-use supplies. For example, laceration kits. Someone comes in with a deep cut and they need it to be repaired. Well, we have a laceration kit with everything we could possibly need and more. And that's where we run into the piece of we're balancing efficiency in the emergency department with supply use and sustainability. I may only end up using 2 or 3 instruments in the supply kit that comprises of 11 or 12, and the remainder all need to be disposed of. And I think some institutions are having these conversations to say there's a lot of waste being generated. How can we advance that? And that's a separate piece about the curriculum I think we may talk a bit about afterwards as well. But outside of the emergency department, we see a lot of this issue in the operating room as well. Lots of people may go into surgery. Lots of individuals, our friends or family or coworkers, individuals who need small procedures or a longer procedure may go into the operating room with the thought that I'm here for a service and I want to feel better, and rightfully so, that their health is a priority in that moment. But the other side of the conversation falls on the healthcare professionals as the resource steward in considering, well, we want to optimize patient care, but how can we also think about resource utilization? And one of the main culprits, and I'm going to say the word culprits, is because we've adopted the use of these anesthetic gases that have traditionally been used, and there are 2 primary ones being used across Canada in the operating rooms. That's desflurane and sevoflurane. Both of these are halogenated fluorocarbons, or part of the greenhouse gases that get trapped in our ozone layer and generate heat and perpetuates it. But between the 2 of them, one of them is significantly better for the environment. That's sevoflurane, whereas the other, desflurane, is 15 times worse in terms of heat trapping and contributing to climate change and global warming. But why is it that we continue to use desflurane when it has a significant impact on our environment? Part of it, as I alluded to, is that traditional piece where it's grandfathered in. But the other component is that patients actually wake up a little bit faster from using desflurane compared to sevoflurane. And it's that time efficiency piece that we're often challenged with in healthcare, to say, well, we want to continue moving along in our schedule, and so we want our patients to rouse from the operating room a little bit earlier, but at what cost? And again, I think it goes back to that piece of having conversations at the higher level with the administrators, with the policymakers, to say, what do we need to have happen to evoke these changes? Initially, I think it was the Montreal Protocol that had changed the use from CFCs, the chlorofluorocarbons, to HFCs, or hydrofluorocarbons, But I think there's been some updates now to say, well, even the HFCs need to be changed for the wellness of our own ozone layer. But that won't take place until decades later. And I think it's advancing those conversations, identifying that these are priorities and having the evidence to back it up. And I think we're trending in the right direction as more and more health professionals are having these conversations. But back to your earlier question, Rosemary, I kind of went into a rabbit hole there. That root piece is, how are we training our future generations of health leaders, and are we doing a good job? And I think we still have quite a ways to go. I think we're going in the right direction, but I think it's these events and conversations that kind of need to perpetuate throughout our training.
Thank you. Thank you so much for that response, because I think you're touching on something really interesting. We haven't typically thought of healthcare professionals as frontline activists. And I think what you're proposing, and what in fact Jean-Paul and Courtney also suggested, is that we need them to be activists. We need them to be outspoken on the issue of climate change. And we need to think better about what are the fully loaded costs of how we conduct medical practices, and the fully loaded costs of climate change on human health. And you're raising some interesting points. And I guess my question is, can we get the health system, when you think about the costs of pollution, because you're touching, Andrew, more on a pollution side of climate change, and you think about the largest environmental cause of disease and death, that's responsible for an additional 9 million deaths every year. Do you think we can get the health system to net zero in its own impact? And why don't you start, Andrew, and Courtney and Jean-Paul, please come in.
Absolutely. I think there are big changes that will need to happen. I'm optimistic. I'm cautiously optimistic about this. Right. I do believe there will be the eventual goal that we reach net zero, but it requires a lot of incremental steps. I think the goal is not to have insurmountable goals where policymakers feel overburdened by large changes, but rather igniting those conversations and creating gradual change where it becomes a common workplace culture and societal culture where we normalize these conversations. One other example where we can easily start moving towards net zero is even for asthmatic patients. There's 3 million, if not more, Canadians who are over the age of 12, so about 9%, 1 in 10 Canadians living with asthma. And many of these are requiring daily use of puffers, if not frequently, throughout a month. And it's been noted that the use of these puffers, there's two main kinds. One is a metered dose inhaler, an MDI, and another is a dry powdered inhaler. With the metered dose inhaler, again, it requires a propellant, an aerosolization, basically another gas that contributes to air pollution. And I bring this up because this is a great example where physicians and healthcare leaders are advocating for that change towards net zero. We're realizing that if we change the use of these inhalers from metered dose inhalers, MDIs, to the dry powdered inhalers without that propellant, we're actually significantly reducing the contribution to gases towards our ozone layer. So in a single month, the use of one of these metered dose inhalers would be the equivalent of a 300-kilometer car journey. And if you think about it for about 150 patients, that's about driving the entire length of the Trans-Canadian Highway each month. And on a scale of 3 million patients, so about 20,000 times more, that's 20,000 trips every month that can be removed with a simple change from metered dose inhalers to dry powdered inhalers. So I'm cautiously optimistic that involving the right leaders will allow us to get into that direction.
Thank you very much. Courtney, would you like to come in on that?
Yeah, sure. And I just want to compliment Dr. Lamb on really communicating that well, bringing it down to equivalencies that people sort of can easily picture. Is not easy. It's not something we're well trained to do when you just like completely knock it out of the park. So well done. And in terms of activism, we actually usually refer to it as advocacy. Advocacy is actually one of the considered pillars of medical training in Canada. And so it is something we're supposed to be trained how to do. Generally speaking, that is framed as advocating for your individual patient. but certainly there is curricula that tends to be sort of poorly applied to teach doctors how to advocate at the population level as well. So I consider, I serve a patient population that extends from Yellowknife all the way up to the high Arctic. So this is one of the most highly impacted regions in the world in terms of climate change. This is part of my core job. I consider this a responsibility under what I have signed up for under the Canadian College of Family Practices Code of Ethics. And just in terms of can we get the system to net zero, so one of my colleagues, former colleagues at the Lancet Countdown, Dr. Nick Watts, is actually in charge of decarbonizing the NHS in England. So he has a mandate to achieve net zero emissions by 2040 for emissions from within the healthcare system, and to achieve supply chain inclusive net zero by 2045. And he is being resourced to do that. So you probably are aware that in the UK, they have this wonderful Climate Change Act where they set goals, I think it's 13 years ahead of time. And then every sector of the economy has goals that they need to meet. So they have been doing this already in the UK for over 10 years. And now they have published a 75-page paper that shows how they're going to actually achieve these net zero targets. And Nick now has, I think, about 135 people working under him, which is orders of magnitude more than the number of people who do this here in Canada. So we've seen him. He's basically thrown the ball and he's running to catch it. Yesterday, in fact, it was announced that about over 25% of the world's pharmaceutical and medical device companies had just signed up to the UN Race for Zero. We know that the supply chain is responsible for about 60% of overall emissions within healthcare. And so essentially what we need to do is have a sectoral approach where the UK says they're going to hit net zero. The US has just launched a national Center for Climate Change, Health and Equity. And so they are going to have significant net zero commitments. The Canadian Medical Association is just starting its work on achieving net zero within the healthcare system here. We've already committed to net zero by 2050, and it may even end up getting moved up. And so if all of us are signaling through concrete action, as well as the messaging and our advocacy to elected leaders, that we are going to hit net zero by 2040 to 2045, and that includes supply chain, that's a signal to the globe's pharmaceutical suppliers and medical device suppliers that if they want to keep selling product, they need to decarbonize their own supply chain. And so really this is a moment where global solidarity can really, I think, get us to where we need to go. And what I know from doctors is that once they learn something, they can go from zero to like 130 kilometers an hour overnight if they do a lit review. And so they'll show up, they'll be like, huh. There were some physician mothers last year who started reading a lot about climate change when they were on mat leave. And this happens not infrequently because all of a sudden people have time. And they said, okay, we want to do something. And I said, sure, how about a sign-on letter? Before I knew it, they had done a sign-on letter, gotten hundreds of signatures, and held a press conference at Queen's Park. And they'd never done it before. And so really the change that's possible is really extraordinary.
Absolutely, and advocacy and activism go well hand in hand, and it's good to know that. And I agree. Once you ignite, the momentum and the acceleration is extraordinary. But you've actually moved us into kind of the global piece and the solidarity piece. And so, as I mentioned at the top, November is now a rescheduled, once delayed COP26 meeting, and the last one in 2015 produced the Paris Accord, which, was a rare consensus that was achieved, an incredible moment, and commitments were made on to keep warming levels low at 1.5 or under 2, depending on how one was interpreted. So you've got a meeting coming up, which is the first accountability session, really. And so the pandemic, the pluses and minuses of this pandemic, it gave us an extra year. So let me start with you, Courtney. What are your hopes and expectations for COP26? What do you think should be in the Canadian Diplomat's toolkit, our policy platform in this area of global health and climate change? Oops, we're not hearing Courtney.
We need the diplomats who are going to COP to understand the connections between climate change and health. And I would say, based on the conversations I've had, I've briefed people in the Department of the Environment and ministers of the environment. I've briefed people in the Department of Health and ministers there. These connections are still not being made. The Canadian Centre for Climate Solutions Choices is helping. They did a report a couple of months ago talking about climate change and health. It was really the first report that's been done by sort of a peri-governmental agency other than Health Canada that really did a good job. And I'm hoping that the next time I go to brief people at the Department of the Environment, they'll understand, because what we're seeing is that we're missing the most important narrative piece. And I've been lucky to work with one of the world's best climate change communication scholars in this area, Ed Maybach from the Yale Center of Climate Change Communications. He actually took a sabbatical leave last year and dedicated the entire thing to working with the global climate change and health community, because he knows that really we have the solutions we need. This is about creating the socio-political change to implement them. And that's about humans deciding to do things. And so this is really about persuasion. And so we need to be using the evidence, not only from the climate science perspective, but also the climate communications perspective. And this moment in time, as you've pointed out, where health has really been highlighted. And it's really all aligning with, hey, let's talk about how many lives we're going to save through the work we're doing. And so I'm on the WHO, the World Health Organization, Civil Society Working Group, and the Global Climate and Health Alliance Board. And we've been doing a lot of work to create a sort of momentum heading into COP. So there will be greater centrality to the actual negotiations of health than has ever been had before. We've been working with the COP presidency, and so there will be significant work talking about highlighting Nick Watts' work at the NHS in terms of low carbon health systems, as well as talking about the need for actual climate resiliency within health systems. And I find the more you make clear to people that the things that they depend on really depend on the climate, the more people are motivated to work together to work for change.
Right. Thanks so much for that. And we are into that countdown mode, and so you can feel in the journals and in the meetings and the conferences this urgency to make sure we don't miss this moment. Jean-Paul, I'm going to turn to you. You have a particular close-up lens on the impact of climate change and health equity. What would be your 3 priorities to come out of COP26?
Sure. Coming from this from the perspective of being concerned about emerging diseases and preserving of antibiotics for human use, I guess I would say that my 3 things all fall under the same umbrella, which is of the One Health paradigm. So the One Health paradigm marries a concern for human health and environmental or planetary health all together, and really shows how these things are very much interlinked. To go back to that of farming, of livestock, most of those antibiotics which are used in this setting are used not as not for their medicinal value, but because feeding livestock antibiotics is a growth promoter. Um, so I don't think we should begrudge anyone for wanting the same standard of living here that we enjoy in the West. So I think what we need to do is offer alternatives, um, and kind of to echo what my colleague said earlier. I think innovation and advocacy are the way out of this. For example, with the example of using antibiotics as growth promoters, there's all sorts of other novel solutions here that are being developed, such as using feed enzymes and things like that to improve the yield of livestock, as opposed to using these antibiotics, which most of them are antibiotics that are important to human health. And in those cases, we end up with nasty surprises when those antibiotic resistant infections that pass around these farms end up in the hospital, and then suddenly we can't treat people with those antibiotics because we've already allowed resistance to develop. So I think there's also other other avenues out of this as well. Lab grown meat, I think, is very promising, if perhaps odd to think about, but I think we have to really look at every avenue we have here and make sure that the alternatives, as opposed to just chastising developing
Well,
countries for
it's a
wanting what we want, right? Or what we have, rather.
true, and you're bringing in one of the many of those other codependencies. I mean, people don't normally think about animal husbandry and the human health and climate change connectivity, or the nutrition challenges of low cost proteins, etc., across the world. So um, it's a big agenda for certain. But Andrew, when we think about this moment for COP26 in November, it's going to be another 5 years before there's another opportunity for an accountability meeting like this one. It's the Canadian Federation of Medical Students. Have they developed a platform for COP26? I think about people like you and Jean-Paul. You will be, well into your careers by the time this rolls around again, and so just wondering, what are your hopes for it, and how do you see yourself placed, since you're at the beginning of that career, and your commitment is early stage in terms of this multidisciplinary but also the multilateral world that COP26 represents, for both opportunity and incredible challenge to get things done.
Yeah, absolutely. Thanks for the question, Rosemary. And from the Canadian Federation of Medical Students perspective, they are doing a lot of advocacy work, and they have a report on they have the national report on planetary health education, and they've also submitted commentaries to Lancet Public Health, internationally recognized journal. And there's a lot of advocacy work for promoting health system education and reform in terms of how the curriculum is developed. Going back to that root cause piece, how do we shift the system so that our future trainees are well equipped to be in line with the climate and planetary needs? And I think that more than anything is a stance that the Canadian Federation of Medical Students is taking on to align with the COP26 priorities, whether it be for sanitation, clean drinking water, sustainable practices, land use, supporting uh, net zero targets as well. I think those are all encompassed from the Federation's perspective by addressing that root cause. And my personal take on it, where I see my own involvement, is very similar. And I hope to be involved with the other panelists here as well in the future too, about the advocacy and how we can drive those changes at that systemic and policy level. Because at the end of the day, there's a lot of conversation that takes place, whether on a personal level, at a clinical encounter, or at a population policy level. But really, it's that policy, high system level change that evokes all those downstream effects that leads to us actually attaining those targets that COP26 has. And I've alluded to it, but my personal take is certainly clean drinking water. We can always start at home first, set a good example for other nations as well. And certainly that allows our nation to build credibility and to act as a leader on this international stage for planetary health. Um, other forms of advocacy, much like Dr. Howard and Jean-Paul have alluded to, being part of organizations that have a strong voice to advocate for individuals who may not necessarily have that platform to speak up and drive that change as well. So certainly those are the areas where I see the Federation taking on and where I see myself taking on in the future.
Right. Thank you for that. And, I think as we think about, the next few weeks, and still the moments where there is opportunities for inflection and for advocacy and influence, I think the three of you have a huge role to play. And then the work really begins, doesn't it? Because you can have good policy, but policy has to get enacted. And getting enacted requires the experts, but it also requires it going through the political lenses, um, and kind of the absorption capacity of households and regions and national constituencies. And we've certainly seen that with the pandemic, that the policy makers rely on the experts like yourselves, but then they have to then take that scientific evidence, that evidentiary base, and determine what is the absorption capacity and the probability of how to manage it for success. So these policy moments are fraught, and great policy does not necessarily mean implementation and execution, as you all know. I'd like to change course a little bit and just kind of bring it back home. If you could comment, and I invite all of you to do so, is the issue of climate change and its impact on cultural activities like fisheries and hunting and social traditions and ceremony, etc. These also have an impact. So we often go down to the level of, nutrition issues. And I mentioned a moment ago, the notions of the challenges of low cost proteins, etc., that are less climate impacting. But traditional diets and traditional ceremony and practices are also profound losses that we've all become very cognizant of across the world. Courtney, you sit in the subarctic and manage healthcare across the high Arctic as well. Could you comment on your perspectives and what you're seeing locally?
Sure. So this is a very interesting conversation. I was actually involved in the conversations leading up to the development of Canada's National Food Guide on behalf of the Canadian Association of Physicians for the Environment. And what I found was that when I was in the north doing the consultations here, I was sort of called upon and needed to talk about lentils and beans and the nutritional advantages of a plant-rich diet. And when I was in the south, I had to remind people that the traditional diet of Indigenous peoples in Canada and other places is not what has gotten us into the climate crisis. Right? When we look at the carbon emissions per person, there is an incredible difference in carbon emissions between countries, between people of different socioeconomic strata. And basically, the richer people are, the more emissions they make. And so I've often found that that issue of emissions equity is not taken into account in these conversations. To sort of give you an example, my husband is going hunting in 2 weeks. My husband's a pediatrician. He's going hunting with his cousin. We have quite an extended family of Dene people. And if they get a moose, we are going to eat that moose because it's probably the most sustainable food that we can eat up here. We've got a low population center. And so whenever I have avocados in my kitchen right now, but when I look at an avocado and I think to myself, okay, so really you can't make an avocado within thousands of kilometers of where I live. And meanwhile, Great Slave Lake is one of the world's probably biggest fisheries that is not already fished out. It's quite sustainable. And so we need to be really careful how we frame these conversations. We know that we can feed the world in a sustainable way, according to the Eat Lancet Commission, save, I think it was 11 million lives per year, as well as make a huge dent in greenhouse gas emissions by using a low meat as opposed to a vegan or a vegetarian diet. And so that means we can still have the foods we love, we can still have the traditional celebrations at Christmas, and it's more to start regarding meat as a treat as opposed to anything else, and still really celebrating these cultural practices that lend so much to our body, our mind, and our soul.
I think you've just developed a new hashtag, meat as a treat. Which I think we can all start to use. I like it very much. I've certainly followed that pattern since I was a teenager, which has been a long time. And your expression of emission equity is an important one as well, because as you say, it's not simply a north-south divide, which it gets popularized, that notion. It's the subunits of emission equity across populations is a really fundamental one. So thank you very much for that. Andrew, Jean-Paul, would you like to come in on this as well? Andrew, I can start with you.
Yeah, absolutely. I think there are a lot of considerations that we as the public and members of our community can can take from this conversation and the COP26 imminently taking place. I would like to add that the viewers and participants who are likely to be in attendance here are, I would imagine, very planetary conscious to begin with. And so I would encourage you to continue taking those steps to be cognizant, but also to be, this is a very unpopular opinion, but to be slightly cynical with what we hear and to consider the choices we make and those of people around us, and think about it critically. Why is the community and society operating the way it is? Is there a way things could be done better? And I mean it with a cautious level of optimism again, to be cynic in the sense that, could we be doing something better? How can we achieve that? And who do I need to speak with to start having those conversations? And you never know where the dialogue will take us, because perhaps the individual, when the pandemic is over, or even virtually, you never know who's sitting across from you at that virtual dinner table, and what that conversation, where it may lead you to, and what change may evoke. And I think it goes back to some of the points that Dr. Howard was also mentioning, how we see a lot of local change. We can consider things like, even in an urban center like Toronto, the built environment, land use, road safety. I mean, I'm a cyclist myself, and given the importance of climate change and reducing emissions and a lot of advocacy, Toronto has a lot more bike lanes now as well. And I think these are things that have come about given all the interest and advocacy from individuals in our community. And I would encourage everyone to continue doing that.
Thanks very much. And I think you've kind of moved us, and I'm conscious of the time, but just in terms of the messages some of you have said, is we need to make it personal. And so, I think a lot of us have spent a long time, hearing about what we should be doing, recycling and so on. But, I think are we not at a stage in human history, and the red alert of the report 2 weeks ago, that we need to up our individual commitment, from dietary choices, as you say, to, becoming more activists, either with our pocketbooks or with our voice and the influence we have. And we talked about the incredible influence right now that health professionals do have. So what would you say as you kind of leave this, in terms of, the what you can do message, that we can do to join forces with the health sector? Jean-Paul, I'm gonna start with you, because I know health equity is a really important part of your work and your research and your passion.
Yeah, I'm going to actually go in a slightly different direction here and say
Sure.
that something that people can do within their own organizations, whether that's government or industry or wherever they work, is to encourage openness and transparency with information. I think this is a lesson that the world is learning as a result of the COVID-19 pandemic. We've seen a huge explosion of open data, certainly from our government, as well as from other governments around the world, in terms of mitigating some of the effects of our interactions with the environment. You mentioned earlier cheap sources of protein. Live poultry markets are common in many developing countries, and these also, unfortunately, a good way for novel diseases to make the jump from animals to humans. But I think that we've had an enormous infrastructure built up with early warning systems and testing of genetic sequences of viruses. And frankly, a lot of developing countries have done a much, much, much better job than Canada in terms of sharing all this genetic sequence data, which has really helped us to understand this current pandemic. But we've also seen innovations in wastewater disease surveillance and all sorts of other things. And I think that this will help us to confront the pandemic we find ourselves in, future infectious disease threats, as well as just our general interaction and management and stewardship of the environment. So, if that's my message, if I have any message, it's that we should encourage this openness and transparency with information, because if we can't measure something, if we don't know something, it becomes much harder to act on it.
That's very true. And data and evidentiary basis is kind of first order to really have that credible influence of an advocate and an influencer. Andrew has already commented on this. So, Courtney, I'm watching the time, but how about last word to you?
Sure. I think it's a time for us to look at what has worked and scale those solutions. We know that here in Canada, the Health Voice, in association with community groups, was really key to making the argument to phase out coal-fired power plants in Ontario by talking about keeping kids out of the emergency department with asthma and saving healthcare dollars. And then we did pretty much the same thing in arguing for a accelerated coal power phase out plan in Alberta and then nationally. And then that national commitment was what allowed Canada to co-found the Powering Past Coal Alliance with the UK, which has served as sort of a climate club. And we're seeing some of the coal-powered policy coalescing around that. So instead of spending our time talking about what needs doing, what didn't work, taking a look at what did work and replicating that and telling those stories of inspiration instead of the stories of despair is, I think, what's going to give us the energy at this moment of crisis to do the work, to find our people, and for it to really be fun and positive and solutions oriented for everybody. That's what I'm working on right now, and I'm seeing a lot of energy for that around the world.
I really like that as a final message because I've heard all of you express optimism. Like we know the solutions. We just have to get more people involved in both understanding and making it accessible, intellectually accessible for everyone to step up. And I think the message kind of takeaways that you've given to me and to all of us is, make it personal so people can relate to it. Don't get too lost in the numbers, but as Jean-Paul said, don't ever forget it's got to be data evidence driven. So make sure the data is good and engaging as opposed to putting people into defensive kind of positions that, because then you have to work hard to bring them back on side. And then the necessity of talking about this, but informing yourself as people are, so you can be a good, important contributor, but talking about climate change in an open and engaging and opportunistic and optimistic way as well. And I think the one thing, that we touched on a little bit is, always look at who's at the table, the metaphorical table. Make sure that everyone's included, all of those different voices and different experiences, the differentiated voices, and then scale, copy, replicate, mimic the successes, so that we can accelerate all of this very quickly. I want to thank the three of you very, very much today for sharing your experience and your wisdom and your passion and certainly your optimism and enthusiasm. It's great. This is our kickoff for the fall in this final leg of the journey to COP26. We'll be talking in just a couple of weeks on October 12th with my co-chair Diane Sachs. We'll lead a dynamic discussion on climate action and Indigenous heritage programming. And we kind of hinted at that a little bit in our conversations, but there's so much more to be said, as all of you know. So thank you all. Thank you for the time today, and many thanks to our principal, Nathalie Desrosiers, for allowing us to convene these very important discussions. Thanks again, and everyone keep well.